So I will briefly present to you some research that we have carried out. We at EUIPO have carried out together with the OECD on the international trade in counterfeit medicines. Some of those figures were already mentioned earlier by the European Commission, but I will give you a more, let's say, a fuller presentation of our study. Just as a bit of background, EUIPO has been working with the OECD now for 6 years, and in that time we have published now 9 studies, in fact, starting in 2016, looking at various aspects of international trade in counterfeit goods. And in fact, we published the latest study just last week, Tuesday of last week, in which we for the 3rd time, estimated the total volume of international trade in fakes, and also in particular from an EU perspective, the total volume of imports of fakes into the EU from 3rd countries. And those numbers are huge. We're talking of something in the order of 120 billion euros. Aside from looking at the overall total picture, and the report is available on the EUIPO website, so I encourage you to take advantage of that. This is true for all the reports that you see on this page. We have looked at specific aspects of trade in counterfeit goods. So, for example, we also published a study on container shipping. We published a study on small parcels. We published a study where we specifically looked at trade routes. And also, we wanted to look at counterfeit medicines in particular, because counterfeit medicines are, of course, important for reasons that we all understand. But so overall, the finding of our studies of our research with the OECD can be summarized in a few bullets. It's a phenomenon on a massive scale. Okay, it is not something that is done by amateurs. It's something that is done on an industrial scale by organized crime groups, both the production and the distribution of counterfeit goods. They can originate from anywhere, although in practice there are some countries, in particular China, that are the world leader in production of counterfeit goods. But other countries are also important in this trade. In our latest study, China, Hong Kong, but also countries such as India and Turkey are important sources of counterfeits. This business misuses modern logistical solutions. This is why we looked at the container shipping, but also, for example, free trade zones are often used by people who want to manufacture and distribute counterfeit goods. Small parcels are misused, so there the sheer volume makes it difficult for the customs to keep up. And another learning that we have is that almost anything that's branded and the brand is valued by consumers can be faked and is faked. There is a common perception that things that are faked are mainly, luxury goods or fancy handbags and so on. And yes, those things are faked as well. But even things such as washing detergent, completely mundane things, are faked as well. Okay, and we have estimated, we do these studies mainly from an economic perspective, so we try to estimate some of the resulting damage to the legitimate economy in terms of lost jobs, lost revenue to the legitimate companies, the taxes that are lost by the government, because of course it's an illegal activity. People who are engaged in illegal activities usually do not pay taxes. But also health, safety, and environmental damage. And of course, the health and safety aspect is particularly important when it comes to fake medicines. So this is a study that we published in March 2020. So it is based on data from before the COVID pandemic struck. I will have a few things to say about the COVID pandemic at the end of my presentation, but basically the study predates COVID. It was published just as the COVID in fact, it was published a week before much of Europe went into shutdown in March of 2020, but it was a pure coincidence that the study was finished at that time. In that study, we looked more deeply at the counterfeit medicines. So the questions that we seek to answer is what kind of medicines are most often targeted by counterfeiters? What is the scale of this counterfeiting? How do they get the medicines to consumers? which countries are the main producers and what are some of the health consequences that result from this trade. The data on which the study is based is, as is the case with all our studies that we carry out together with the OECD. This is customs data on detentions of counterfeit goods. So the three main sources are the Customs Administration, so data we get from the World Customs Organization, from the European Commission, DG TaxUD, and from the US Customs and Border Patrol. Those are the three main data sources. And then we combine it with other data that we get from enforcement, some of it confidential. We get some case level data, and so we combine the different data sources to try to paint as complete a picture as we can. Okay, why do organized crime groups engage in production of fake medicines? Well, it's a very attractive business from their point of view. The profit margins are high because, of course, as we heard from Estia just a moment ago, the legitimate pharmaceutical industry invests huge sums of money in research and development. But once that research and development is completed, the marginal cost of producing even the legitimate drug is quite low, and the marginal cost of producing the fake is even lower. So it's a business with very high profit margins, and the risk of being caught are quite low. And if you do get caught, then the penalties are also quite mild compared to other types of crime. For example, if we compare the penalty for selling counterfeit medicines to the penalties for selling narcotics, this tells you about some of the difference, especially in your part of the world. In Asia, for selling narcotics, many countries still have the death penalty, whereas for selling counterfeit goods, including counterfeit medicines, the penalties are nothing comparable to that. And finally, it's easy to deceive the customer because most of the time, we buy medicines because we need them usually to cure some disease or to alleviate some symptoms. And most of us are not experts on pharmaceutical. We go to our doctor, we get the prescription, we go to the pharmacy, we fill that prescription. Nowadays, in many countries, that pharmacy can be an online pharmacy, which is precisely part of the problem. But in any event, another feature of the pharmaceutical industry is that the supply chains are very long and very complex. And this means that there are many potential entry points for the counterfeiters where they can infiltrate the legitimate supply chain and get their product into a legitimate pharmacy. So you can have a situation where a patient gets a prescription from his doctor, goes to a pharmacy, fills that prescription, and ends up getting a fake medicine, but neither he nor the pharmacist who is dispensing it to him is aware of that. So both of them are victims in the sense. Obviously, the patient is the greater victim because he obviously will suffer the consequences of ingesting a fake medicine. So it's quite easy to cheat the consumer. In terms of magnitude, so we estimated that in 2016, which is the year on which the study is based, the volume of international trade in fake drugs was $4.4 billion, which makes it the 10th most counterfeited type of products in international trade. And of course, this does not include fake medicines that are both manufactured and consumed domestically, including, for example, within the European Union. Because those are not subject to customs seizures. So it's only products that cross an international border that are included. Okay, so that's the economic part. Now, what's really interesting is to look a bit in more detail at what kind of medicines are being counterfeited, because there, the common perception is that it's mostly drugs such as Viagra, for example, and so people can even laugh about it a little bit. Okay, so you get a fake Viagra and you get disappointed in a certain way, and can even be somewhat embarrassing and all that. And sure, those types of drugs, which we call lifestyle drugs, are among those that are fake. But what we found in the study is that many other types of medicines that are much more serious, so to speak, are also subject to counterfeiting. And we list some of them here. So drugs against malaria, HIV/AIDS, cancer, antibiotics, painkillers. So really anything that can be faked is faked. And I don't have to tell you about the potential consequences of for example, a cancer patient who takes a drug that is in the best case is just a pure placebo, and in the worst case can be directly harmful to the patient. We have some other examples from some other sources in the report. For example, the Pharmaceutical Safety Institute, they found 15, they examined some hundreds of counterfeit medicines and found that they covered 15 different therapeutic categories. Okay, so we're not talking about the small blue pills here only. We're talking about a lot of serious medicines for serious diseases. You can see some numbers here. So in terms of the ranking, so to speak, so the top category are antibiotics, actually accounting for something like 37% of seizures, followed by sexual dysfunction treatments like Viagra, followed by painkillers, anti-malaria drugs, diabetes treatment, heart disease, and so on. So you can see, again, a great variety of different medicines are subject to this. So as I said before, complex trade routes, complex distribution chains. The primary producers of fake medicines are India and China, in that order. So in fact, this is, of all the product categories that we have studied in detail with the OECD, medicines are the only one where China is not number one. China is number two, India is number one as a source of fake medicines, probably reflecting the fact that India has a very large and very powerful manufacturing industry in this sector. And some of the main transit points are UAE, Singapore, and Hong Kong, because those are some, in general, important transit points for international trade. The main markets that are targeted with the fake medicines are, of course, as we are used to with other counterfeit goods, Europe and the United States. That is true for most categories of counterfeits. But in this case, also countries in Africa are big targets. And this is quite different from other categories of counterfeit goods, because if you look, for example, at counterfeit luxury products, it's not worth targeting African countries because they have very low incomes per capita, so there are few people there who buy luxury products anyway. But in the case of medicines, it is an attractive market because there are some diseases that are quite frequent, quite endemic on the African continent, malaria, for example. And even though so people have to buy these medicines, those medicines tend to be quite inexpensive. But if your production costs are only 1/10 or less of the price for which you can sell that fake medicine, then you still have a huge profit margin. And these unscrupulous people, unfortunately, are taking advantage of that. So some of the ranking of the different countries. So you see here India in first place in terms of both value and the number of seizures of counterfeit medicines. As I mentioned before, free trade zones are often misused to carry out this business, and in the case of transporting them to Africa, also container maritime transport is frequently used. In the case of the US and Europe, as I mentioned before, the role of online pharmacies is becoming especially relevant because there are many countries where consumers now are increasingly turning to online pharmacies to buy their medicines. This is, of course, primarily for reasons of price, sometimes also convenience. And this means that the volume of small parcels that contain medicines is increasing, and some of those small parcels, of course, contain counterfeit medicines. And this places an additional burden on the customs service because, of course, the sheer volume of such shipments is huge, and also it's very difficult for customs to tell whether a particular medicine is fake or not. Here we see some figures here that in terms of the total number, the two pie charts at the top show the proportion of custom seizures by the various modes of transport. So you see there that between 2014 and 2016, overwhelmingly 95% of the seizures consisted of mail or postal or private express company, small packages, with 5% being air freight. But if we look at it by value, then actually the small parcels accounted for only about half of the value of the seized fake medicines, with air freight accounting for most of the rest. Okay, so what are some of the impacts? Again, it's almost stating the obvious that there will be negative health effects on the patients, because of course, if you are sick and you need a medicine, you get a fake. That fake can either be a completely neutral thing, so it will not kill you, but it will also not cure your disease. So that's or it can be directly harmful. But also in the production stage, these fake medicines are often produced under very bad conditions. So there is a lot of environmental pollution. And of course, there's economic damages, as we have from other kinds of counterfeit goods. There's just one number that, in terms of the health and safety impact, I want to mention one number that we quote in the study. This is from the World Health Organization, which estimates that as many as more than 100,000 children die in Africa every year as a result of fake malaria medicines. Okay, so this is not only, I mean, we will talk about economic impact, but this is really a tragedy in human terms, what is happening. So the report is available on our website, and I encourage you to take advantage of that. Again, as I said, this report does not cover the impact of the COVID pandemic, but what we did see in 2020 is that the counterfeiters take advantage of the pandemic, of course, in various ways. And so in the spring of 2020, there was a flood of counterfeit protective equipment because there was a shortage of protective equipment. Later, when in the summer, let's say in the summer of 2020, when certain medicines were mentioned in the media as potentially useful for treating COVID, immediately offers of those fake versions of those medicines inundated people's mailboxes, and of course more recently there are various scammers that offer vaccines and of course we try to educate consumers, telling you can never buy a vaccine from a private source. They are always administered by public health systems, but again, the counterfeiters and the scammers take advantage of any situation. I mean, they are criminals, but they are very good at what they do. They're very adaptable, and it's a big challenge to combat this phenomenon. So I thank you for your attention, and I have a few slides to finish that summarizes what I just said, and maybe giving some examples. So Europol has documented some of the seizures some of the actions that have taken place, that they have taken, and I think I put some examples. So here you have from a Europol press release from just last week, in fact. And this is not directly counterfeit, it's just regular fraud, which is another phenomenon that has increased a lot. So you can see here that people cheat. In many countries there is financial support for companies and for people who are out of work because of the shutdowns. And there are 6 people arrested here in France for defrauding the system in connection with that. Here you have false negative COVID certificates, because of course, as you all know, increasingly to travel, you have to show a negative COVID test or prove that you've been vaccinated. Those certificates, again, are being faked, and Europol has issued a public warning about it already earlier this year. And the same thing, and here is one on vaccines from Interpol and the US Homeland Security, which again stress the fact that you cannot buy legitimate vaccines on the internet or in any other private source. Okay, so more to come. As I said, please help yourself to this study.